Hello, I am Dr. Gauri Gore from Mumbai, and in this video I am going to talk to you about planning a pregnancy. Couples usually have questions around planning, as what is the best age to have pregnancy? Is it okay if I postpone my pregnancy plans by few years? Are there any investigations required before we try? What medicines to take? And how much time would it take for us to have a child once we start trying? I'm going to throw some light on this. So first question is, what is the age, what is the best age or best time to have a child? In my opinion, the answer to this question would change from uh, time to time. It would change from location to location as well. So I'm going to speak from the point of view of an urban setup where usually the girls have priorities about education, career, and they do have some plans about their economic independence as well. From medical science point of view, a female body, uh, it takes time to mature to have ability to carry pregnancy safely and nurture a child. So at least till 20 years of age, it is best to avoid pregnancy. And after 35 years of age in a woman's life, the possibility or the potential of conception goes on decreasing gradually. So we are talking about the phase of 20 to 35 years, which is a span of 15 years. In urban area, now the marriage age is increasing day by day. The women are being more independent, and hence the pregnancy before 25 years is now not a very common phenomenon. Now I am speaking from the point of view of a city based practice. In rural areas, the picture might be completely different. 25 to 30 years is the phase where women do get married. Some people do consider pregnancy, but a lot of times a girl has to achieve some goals in her career, economic situation. Some courses are long enough where the qualification itself takes about 12 years or 15 years. So the age for having pregnancy is gradually crossing above 30. A span of 25 to 30 years is best suited for pregnancy because the body is completely developed, there is a good level of maturity, and there is less likely possibility of any lifestyle related diseases. So the possibility of complications in pregnancy for the mother or the baby are also lesser. It doesn't mean that if the pregnancy is above 30 years, it is full of risk or it poses danger. Having said this, I would only say this, that make an informed choice. If you are postponing pregnancy because of certain family, personal, social issues, you should also be aware that as you prolong the age for pregnancy, the chances for um, requiring some treatment for conception and pregnancy related complications also will go on increasing. So whenever you decide that you want to have a child in later life, it might take longer time, or at times you might need to take some treatment for getting pregnant. I'm not saying that when you're younger you may not, but the possibility is lesser. And at the same time, a good news is that in case the pregnancy is prolonged and because of higher age, if there are any complications or uh, you need to take any treatment for conception, there are multiple treatment options available. So make your choice wisely. The second question is about the investigations or the test, if any, required for before planning a pregnancy. Now, many couples or women also do walk in to ask for a fertility test, and they want to know whether I will be able to conceive maybe 5 years later, 3 years later. And I tell them that there is no such thing like a fertility test, or whatever tests are done are basically done to figure out, is there any one particular reason for a couple who is not able to conceive. But there are certain tests which are good to do whenever anyone is planning. For example, hemoglobin level. If the hemoglobin is on the lower side, what we call as anemia, there are implications for the mother and the baby. The baby's growth also can get hampered, and there are a lot of pregnancy related complications. So in that case, it is better to start taking corrective measures before one gets pregnant. We have to give them supplements, do some dietary changes, also find out the cause of anemia. Another thing is about thyroid levels. It's very common to find thyroid abnormalities in the younger age group. On either side of the spectrum, whether the thyroid function is on the higher side or it is on the lower side, it does have impacts on pregnancy. So get your thyroid level examined, and if it is abnormal, then accordingly the treatment can be started. Blood sugar level and blood pressure measurements. As we are seeing the age for pregnancy is increasing, we also are countering that the age for all these lifestyle related diseases, diabetes, blood pressure, is reducing. So we do see many would-be mothers who are already on to some medications, treatments for diabetes or blood pressure. So if you have not got any of these tests done recently, get yourself checked. One not very popular test which I would recommend is HB electrophoresis. Now, hemoglobin electrophoresis is a test which will tell us if the hemoglobin that is being formed is normal or it has any abnormalities. It is not only about the level of the hemoglobin, it is about the type of the hemoglobin. I'm sure you all must have heard about a disease called thalassemia. The hemoglobin electrophoresis does pick up traits like thalassemia minor and sickle cell traits, where a trait means the genes are present in an individual but the individual doesn't have disease. So if HB electrophoresis test for a girl is abnormal, then we'll have to investigate her partner, get HB electrophoresis of her partner to find out if there is a risk of developing a disease in the child who's unborn. So HB electrophoresis is something which is worth doing. And that doesn't change over a period of time. If one has thalassemia trait, the person will be a carrier for life. Sexually transmitted infections, what is called as STI, is another set of tests which will tell us what is the health profile of an individual before someone is pregnant. HIV, hepatitis B and hepatitis C are some of the common tests which can be done, and simple blood tests are available. Whether one should do a sonography, good to do if you can. Sonography does pick up a lot of abnormalities which can have impacts on pregnancy, particularly uterine abnormalities. Some structural malformations in the uterus can be picked up in sonography, and they would need correction before one tries for pregnancy. Of course, the result of sonography is highly observer dependent. So it depends on the type of sonography done, the center where it's done, and the person who's doing as well. So there are a couple of other tests which are available. For example, semen analysis and a lot of hormonal tests for the female. But these are the tests which are advised by doctors in case some couple is not able to conceive. These are not the tests to be done blanketly, because they need to be interpreted based on some background information. Semen analysis is a test which is done for the boys or male partners, and couples do ask whether they need to undergo this test right at the start when they plan for pregnancy. The answer is no. The semen analysis test can have some abnormalities, which may or may not need any action, or we just have to give some time to interpret the results in a better manner. At the same time, if there are any minor abnormalities or borderline abnormalities in the semen analysis test, it creates a lot of anxiety, which is detrimental for chances of conception because it directly impacts your performance. Of course, if a male partner has certain problems like diabetes, they have ejection dysfunction, or some kind of chronic illnesses they have been getting treatment for, like cancer, some autoimmune diseases, where it is likely that semen count might get impacted, then definitely it is worth doing the semen analysis, but not for all. Similarly, the hormonal tests are not to be done just to know if a particular lady is in a position or is in a fit manner to have pregnancy. The best test to know that the hormonal profile is normal is to have a regular menstrual cycle. Of course, if there are any abnormalities, the doctor would advise you certain tests. So, in terms of investigation, I repeat, the tests which are recommended for all those who plan to have a baby are CBC or hemoglobin levels, hemoglobin electrophoresis, blood sugar test, thyroid levels, and blood pressure measurements. Now, the third aspect is about what are the medicines which are required. There is a recommendation of starting vitamin supplements that's called as prenatal vitamins. It includes vitamin B9, B6, and B12 for anyone who's planning a pregnancy. A girl who is attempting for a pregnancy can start with this one tablet containing 3 vitamins. It is recommended to reduce the chances of any congenital defects in the baby, what we call as neural tube defects. It also improves the chances of pregnancy and reduces the risk of miscarriages. Ideally, this prenatal vitamin should be started at 3 months before conception. What is the best time to try in terms of menstrual cycle? If your menstrual cycle is regular of 28 to 30 days, 10th day of the cycle to 18th day, that particular week is the time where maximum chances of ovulation are there. So if intercourse can happen in that particular week, it improves the chances of pregnancy. But this calculation holds true only for those girls where menstrual cycle is normal. If your cycles are irregular, if the cycle interval is too long or too short, then this calculation may not hold true. The last question is, how much time will it take for us to conceive? There is no time limit as such, but if all the parameters are normal for the couple, if all the baseline blood tests and other investigations are normal, and if the intercourse happens maybe twice or thrice a week, then we can, or the couple can wait as long as up to 1 year to have a baby. It can take time because of multiple reasons. In today's scenario, if not 1 year, at least you can wait for 6 months. You can try for 6 months. If the result is not positive, then you can obviously approach a doctor for further advice. So this was in short about planning for pregnancy, and in my next videos I will discuss about how to go about once you have got the good news. Thank you.